Hello, my soulful babes, and welcome back to my YouTube channel. Today, I'm going to be talking about the blood test that I recommend every person with PCOS get so that you can heal your PCOS holistically without dieting. Blood tests are the first thing that I do with all of my clients for three main reasons. The first is to determine what your PCOS root causes are, because this is what is driving your irregular periods, your acne, excess hair growth, hair loss, fatigue, skin condition, gut issues. The second is to establish a baseline of your hormone levels and of other health markers. And then the third thing is to be proactive with reducing your risk of future health complications like type 2 diabetes, heart disease, fatty liver disease, and many more that PCOS is associated with. So the tests that I'm going to share with you are going to be a lot more extensive and specific for PCOS than what a lot of doctors do. Because if you're going to a general practitioner, for example, or a primary care practitioner, I think is what you call it in the US, they have so many conditions that they need to be aware of that they don't have as extensive knowledge with a particular condition if they haven't dealt with it, like PCOS. So they kind of only know the general thing and they don't know something as specific as I do because I have been focusing on PCOS for the last 5 years. For example, one of my clients, let's call her Shauna. She got diagnosed with PCOS and had rapid weight gain and irregular periods, but was told that her bloods looked normal because her fasting blood sugar levels and her HbA1c looked normal. But when we did more specific testing, we actually found that she did have insulin resistance. And so we started creating holistic habits that balance her insulin resistance, that balance her hormones. She regulated her weight so that it was stable and no longer rapidly increasing. And she got her periods back regularly within 6 months. One of my other clients, let's call her Anne, she was put on max dose metformin for her PCOS, and metformin is a medication for insulin resistance. But she had been on it for months and she saw no difference in her energy levels. She was still constantly exhausted. She still had cystic acne around her chin area, and she still had hair loss coming from and balding her hair at the top of her head. But after we did extensive blood tests, we actually found out that her root cause wasn't insulin resistance, it was adrenal dysfunction. She also had a vitamin D and vitamin B12 deficiency, which makes sense because she was on metformin, but we'll talk about that more about that later. So we created holistic habits around supporting her adrenals to come back into balance. And in 6 months, baby hairs started growing out of her hair again where she was balding. Her hairdresser was so surprised. Her skin started to clear up and her energy improved as well. She actually woke up refreshed as opposed to constantly exhausted. So this is why it is so important to do these more extensive and specific blood tests so that you can understand exactly which hormones are imbalanced, what is your PCOS root cause driving all of your PCOS symptoms, and you you address the root cause directly. That is going to help all of your symptoms. So let's get into it. What are the blood tests that you need to get? I've categorized them into 3 different categories. The first one is to identify your root cause. I've talked about root causes before, and there are 4 main ones. The first one is insulin resistance, second one is inflammation, third is adrenal, and fourth is other hormonal imbalances and micronutrient deficiencies. So for the insulin resistance, this is a big one. Most people have this as the root cause. And the fasting blood sugar levels and HbA1c is usually good at detecting insulin resistance. But for people with PCOS, often what happens is your fasting blood sugar levels and HbA1c looks completely fine. That's why doctors are like, your bloods look normal. But if you do the oral glucose tolerance test, OGTT, with insulin at fasting 1 hour and 2 hours. So what you do is you get your bloods done when you're fasting, and they will get the blood sugar value and the insulin value when you're fasting. And then they'll give you a sugar syrup to have, and then they'll take your bloods at 1 hour and 2 hour. And what that does is it helps to see how your body actually responds to glucose, to sugar. And what we often see is the insulin is often elevated exponentially compared to the blood sugar levels. And that is how we know that you have insulin resistance. It's a different type of insulin resistance in terms of it's more about the insulin than the blood sugar levels compared to type 2 diabetes. So that is a big one that most doctors don't do, but often essential to diagnose insulin resistance in people with PCOS. To understand if you have inflammatory root cause, HSCRP and ESR are the blood tests I would do. This shows the level of inflammation in your body. Fast and simple, that one. The third one is the adrenals. The blood test to do for this is DHEAS and cortisol. These are the hormones that are produced by your adrenal glands. DHEAS is also an androgen. You'll hear with PCOS you have hyperandrogenemia, which means high androgen levels. So DHEAS can be included in that. The fourth root cause are the hormonal imbalances and micronutrient deficiencies. We'd be looking at taking prolactin and the thyroid panel. We'd also be looking at vitamin D, which is deficient in 55 to 90% of people with PCOS. And vitamin D is so important because it's not just a vitamin, but it's also a hormone. And then we have vitamin B12 as well, especially if you're taking metformin, because metformin will deplete your B12. So if you've been taking metformin for a long time, you should be taking B12 in some form, either supplements or the B12 shots. If you have been on metformin and you've been taken off it, again, test your B12 to make sure that it is not deficient, because it can wreck your nervous system if it is deficient. There's also zinc, which when it's low, it can affect your fertility, it can affect hair loss, it can affect skin conditions like acne and dermatitis. And then there's iron studies as well, especially if you have prolonged or heavy periods, or if you're experiencing constant fatigue. It's super important to check your iron levels. Okay, let's talk about the second category, and this is the other baseline blood test that you want to get. And I'm looking here because I have all my notes here just so that I don't miss anything. So, baseline blood tests to get: total and free testosterone, because the PCOS root cause triggers the high androgens, triggers the high testosterone DHEAS and DHT, other androgens that causes your PCOS symptoms. SHBG, sex hormone binding globulin, is often low when free testosterone is high. AMH, so this is about your ovarian stores and how many eggs that you have. And AMH is also a really good way to determine if you have PCOS. If you're in the diagnosis process, then sometimes they'll do AMH, sometimes they won't. But it is a really good way to have a look at what's going on there, because it often means that you have irregular periods, immature follicles that haven't ovulated, which is why you have irregular periods or fertility issues. And then you have your LFTs, your liver function tests. So with PCOS, you're at risk of developing fatty liver disease. So LFTs, tracking your LFTs will help you determine where you are at with that, whether you're okay or you are at risk. And then there's your lipid profile, so your cholesterol levels essentially. And again, this will tell how your cholesterol levels are, because you're at risk of developing heart disease and cardiovascular disease. And the third category is your menstrual cycle hormones. So this is really only if you want to get pregnant, or you have irregular periods, or you just want to know what's going on with your menstrual cycle. The blood tests are luteinizing hormone, or LH, follicle stimulating hormone, FSH, and estradiol, which is your estrogen, and then there's progesterone. So the first three you want to do on day 2 of your menstrual cycle, so the second day of bleeding, and then progesterone you want to do on 7 days after ovulation. So this can be a little bit tricky if you have irregular periods, but your doctor, or if you're working with me, we can talk about how to navigate around that. So these are all the blood tests that I recommend if you want to heal your PCOS holistically. It is extensive. There are a lot of them. But this is the level of understanding of what's going on in your body and with your PCOS that you need if you want to heal your PCOS holistically and quickly. because we are targeting the root cause. We're not just looking at what symptoms you have and putting a band-aid on it. We are looking at what is the driver of all of these and how can we create tailored habits that target exactly what your body needs to be in balance to heal your PCOS and alleviate all of your PCOS symptoms together. When my clients work with me, I liaise with their doctor and send them a pathology request, a blood test request with all of these or the specific ones that I think are relevant to my client. When we get the test back, I interpret the blood test for my client so they understand exactly what's going on, where their levels are. They can track their blood levels so when they do it bloods in future, they can see their progress. And I help them create a tailored plan and create holistic habits that directly target what their body needs to balance their hormones and regulate their periods, get rid of the acne, excess hair growth, and hair loss, boost their energy levels, regulate their weight, and feel more comfortable and confident and in control of their PCOS and in their body. So if that is the kind of support that you want, doors to my 6-month PCOS and intuitive eating program is open. You can work with me one-on-one or in a group. The link will be in the description for you to learn more about PCOS Body Freedom, or you can send me a DM on Instagram. I hope this has been so helpful for you. Please let me know in the comments what you've learnt from this video, and I will see you very, very soon. So much love. Mwah.